My name is Joy Rinaldi. I'm a
Mhm.
speech language pathologist, and I work in a subacute rehab long-term care facility
Okay,
in Ocean Grove.
great. And we're in the middle of Corona, the second wave of coronavirus.
Yes.
And there was the first wave. What was it like when coronavirus first hit? Well, let me ask you first, what's the difference between the unit that you're in and, say, a nursing home? Because nursing homes have been hit pretty hard. Is it pretty much the same thing, or is it? Okay.
So I work in a long-term care and subacute rehab.
Okay.
So we have 3 floors. The first 2 floors are long-term care residents that live there. And then the 3rd floor is our rehab department.
Okay.
So that's where we have our physical, occupational, and speech therapy. And then long-term cares are on the 1st and 2nd floor.
Mm-hmm.
So typically speaking, people would come in for rehab from the hospital and stay on the 3rd floor. And then if they can't go home, they might transition to long-term care on the 1st and 2nd floor.
Okay.
So we have a mix of people there all the time, and then a mix of people that are coming in and out of the hospital and transitioning home or to stay.
Okay. And what was it like when coronavirus first hit back in March?
So when it first hit, we actually started isolation in the last week of February, I want to say.
Okay.
So at that time, our infection control nurse had us start to wear surgical masks and no other PPE, no like gowns or anything, just surgical masks like on a daily basis. So if you were in the hallways or seeing patients, you would just be wearing a surgical mask, and that was it.
Mm-hmm.
As it progressed, I want to say the 2nd week of March, I was at work, and then all of a sudden on the intercom, we heard, if there are any visitors in the building, you exit immediately.
Really?
Yes.
Wow.
So it was like a normal thing for just to be working with a surgical mask, and people were having their visitors. And then just one day it was, governor said no visitors, and they kicked everyone out that minute.
Wow.
People weren't even allowed to like hug and kiss their family goodbye. They just had to exit and shuffle out the door. And then we were closed for visitors ever since. So we haven't had visitors in the building since that 2nd week of March.
So I imagine if there were people who were kicked out who had relatives who were sick already, that must have been really hard, because it could have been the last time they saw them.
Oh, yes. There were a lot of people that have not seen their family.
Wow.
And have since passed on.
Wow.
It's hard to work in long-term care to begin with.
Right.
It took me probably 3 years to stop being very emotional about my job, because you see people in their end of days, and you know, it's something you get desensitized to, because you have to kind of, that's your job and that's what you work with, and that's what you're trained to do. This put a whole nother stress factor on working, because these people depend on their family to visit them and see them.
Right.
And you take them away from their family. And if the coronavirus didn't affect them, then the depression and the lack of human connection is killing them.
Right.
It's sad.
Yeah. Yeah.
It's been very stressful.
Yeah.
You know, I've had patients, my primary job is to work with people that have swallowing difficulties, and I've when it first hit, we were noticing a trend where people were having trouble swallowing, mostly because they either stopped eating because they couldn't taste the food, or they would have sore throats and they would have trouble swallowing. So then the nurse would make a referral to me and say, hey, this person's having trouble swallowing. And I'd go in, and at that time, we weren't really infected. We were just wearing the surgical mask, and I'd go in to do an assessment on someone, and I'm like, what's the matter? You can't swallow. And I'm sitting there looking in their mouth, and they're coughing on me.
Oh my gosh.
And I'm like, I don't know what's wrong. There's nothing that would indicate. And I'd say to the nurse, like, maybe they need to be tested. And then it was after that, it was just one after another. And usually I would be the first one in there to see them, because they were having trouble swallowing, which in fact, it was really coronavirus. So at that point, I was really fortunate not to get infected,
because you were unprotected and probably face to face with these people. Wow.
No gowns. I mean, you usually would wear gloves to go into a patient room, but just a surgical mask. And that first one, I was pretty much had the most contact with that first resident, and they had put me out of work for 3 days to get me tested because they thought that I had a high infection probability, but I ended up not having the infection. But you know, there are people, I had a lot of conversations with their families, like saying that they're having a lot of trouble eating and they can no longer eat and drink and be safe eating. And you know, it's the start of the decline to really stop taking foods and liquids, and then the body just shuts down without eating. And I've had some conversations with people on the phone saying, like, you know, I can't imagine what my dad or my mom's going through, being there alone and not having any family. And very understanding, but very sad to hear them say, like, I haven't seen them in 4 months, and you know, I can understand if he's just giving up and letting go and all that.
Wow.
Yeah. I don't think people realize, like, what it's like in the nursing home, because there's people that are like in their 60s, 70s that are still alert and oriented, and they're able to have full conversations, and they're really in a nursing home because physically they can't be home alone, but they're with it and they're stuck in this facility. And it's kind of like you're stuck there to begin with, and then to put coronavirus on top of it, because, you know, you and I, we quarantine with our families and we're allowed to go outside. We're allowed to go into the dining room or the bathroom or whatever. These residents, they're been locked in their rooms for 10 months now.
Wow.
They're not allowed to leave their room.
Wow.
So if you can imagine, like, being in a nursing home and you used to be able to go to the activity department to play bingo, or go to the dining room and sit with a couple people and eat your lunch or your dinner, and now you're not allowed to leave your room.
Wow. For 10 months.
10 months.
Yeah.
So literally stuck in one square room for 10 months.
Wow.
So, you know, speaking with them, they're depressed.
Yeah, I can imagine.
You know, some workers have their kids like make cards for them and pass them out and stuff, because it's very isolating.
Right.
You know, and I have a patient right now, and he just keeps saying, like, I have no connection. I have no connection.
Right.
You know, you lose that feeling that, like, the human touch is just a connection, and they don't have that.
What do you say to them when they say that they don't have connection? How do you help them, or can you help them? I
try to just hold their hand, and, you know, it's not the same, you know, we're wearing gowns and gloves and everything. And right now, every patient, it's N95, surgical mask, face shield, goggles, gowns, gloves. So, like, they're not even seeing a person in front of them, really.
That's what you have on.
Right. Every day, every patient.
Yeah.
That's what we have to wear.
Right.
So to them, all they're seeing is a couple pair of eyes and nothing else. And, you know, so it's still a little odd for them to really be talking with you dressed up like that, but it's at least something to communicate with someone. Right. You know, and I try to tell them, you know, everyone's going through this. This is across the world, you know, this is what we're all doing. And there have been people who say, like, well, you get to go home and see your family, and you get to go outside. You know? I mean, even in the summer when it wasn't that bad, we were allowing people to go outside, and they only had 20-minute time slots where the activities department would wheel the people outside, and they would have 20 minutes to sit, and there could only be 3 people outside at a time, and they would have to be like 20 feet apart. Wow. And then they'd say, okay, your time's up. You go back inside and go back to your room.
I couldn't imagine.
So,
yeah.
You know, it's hard for them. Yeah. There was a period of time where we were allowing visitors, but it had to be outdoor visitation. So the residents would go outside, and their family would sit about 10 feet away from them wearing a mask. And they would try to talk to their family like 10 feet apart. Wow. But some of our residents are hard of hearing, or, you know, they have trouble speaking loud enough so that their family could hear them, and because they had to wear a mask as well. So it's hard to really connect. So primarily the activities department has been wheeling around iPads and FaceTiming people's families for them.
Wow. That's their primary connection. For like the last 10 months.
FaceTime. Yeah.
So how have you been managing? You've talked about your patients, but that's a heavy burden, I imagine. How do you, from a day to day, like summon the energy and the courage to do that? Or...
I'm not sure. Like I said, it did take a couple years to really get used to working with long-term care to begin with. And now it's kind of just second nature to go to work and put all these things into effect, you know. It's, you walk in the door, I have a desk, like there's a big stop sign as soon as you walk in the front door with a desk where you have to put on your N95, put on a surgical mask, put on your goggles, and then, you know, hand sanitize, go over to the front desk person. They take your temperature and they ask you the same 5 questions every day, which would be, do you have any symptoms? And they'll run over the symptoms, primary shortness of breath, you know, difficulty breathing, diarrhea, vomiting. They'll go through that. You have to say no. Have you traveled anywhere outside of the United States?
Right. In the last day.
It's like, I saw you yesterday. No, it's not. But it's the same 5 questions like every day. Right. And as long as you say no to everything and your temperature's fine, then you get to go to work for the day. You know, and then you go through your shift and then you do the same thing the next day. But typical day is, like I said, the N95, the goggles, and the surgical mask. For working with patients, we actually have stuff outside of every single patient's room where every single resident is treated as COVID positive, regardless. So every patient, I have to put on a plastic gown, gloves, and the face shield. You go in, you see the patient, you come out, you take off your plastic gown and your gloves, throw it in the garbage. You can't imagine. Yes, you cannot imagine the waste that goes on right now because of that. Then you have to sanitize your face shield, your goggles, remove your surgical mask, put on a new surgical mask to go to the next patient and put on a new plastic gown and new gloves and then throw it all out. And it just goes on the entire day, depending on how many people you see a day. Right. And I mean, if the person pushes their call bell because they dropped their remote or something, the person that goes in to help them has to put on all that stuff and then take it all back off. Just to like, you know, because it's not always like the person needs to go to the bathroom. Sometimes like I ran out of tissues or whatever, you know, and you have to put all that on to go in for a minute, take it off. So the waste that is going on is crazy. Right. But
let's go back a little bit to when you were being coughed on. You didn't have any protective gear on.
Not at that time, no.
And then what happened? What went through your mind when you first heard of COVID and you realized that you've been exposed?
So I caught on pretty quickly. So in the beginning, we weren't allowed to wear protective gear because in the beginning, we weren't sure what the outbreak was going to be. You weren't allowed
to wear protective gear?
Not the plastic gowns and everything else because we didn't want to waste things. Because in the beginning, if you remember, we were afraid.
Or was that...
So that was just policies in the hospitals and the long-term care facilities. So that unless we knew that the patient was positive, then you had to wear everything. But going into the room and they were not considered a PUI, a person that was suspected to have the virus, or actual COVID positive, then you would just wear your regular surgical mask. And that was it. After like the 3rd patient that I had a referral for trouble swallowing, I was like,
So did you have to say something?
I had to tell my manager that I was not comfortable. So I actually was the only team member that would have an N95 mask all the time.
Oh my God.
Because for all the other disciplines, for like physical therapy, occupational therapy, the patient would have to wear a mask in order to be working with the physical therapist. But for a speech therapist, the patient can't wear a mask for me.
Right.
I have to look inside their mouth. I have to have them eat and drink, so they can't wear a mask. So for speech therapy, we're considered to be doing aerosolizing work with patients. So they could be coughing in our presence. If they're aspirating foods or liquids, they're going to cough in response to it. So speech therapy is more of an aerosolizing treatment. It's in the air.
Right.
So for speech therapy, we were allowed to wear the N95s and goggles or face shields.
Wow.
So I still wasn't wearing a gown or anything, but I'd be the only therapist wearing an N95 for the 8-hour shift.
And when was that you went to them and were like, hey, I have to wear this protective
That was,
gear?
I think, April.
April, like mid-April or so.
Yeah, mid-April-ish.
So that was like a good month and a half into the, yeah. And April was like when there was like 8,000 deaths in New Jersey in, a month. We were actually pretty good for the long-term care facilities. We didn't have that many positives. And then by April, we had 1 or 2 patients and we thought we had it under control, and we weren't doing weekly testing at that time. So, you think, oh, we're in the clear. Right.
But then all of a sudden it was like one person had a fever, then another person had a cough, and then another person had a fever, and then the test results were coming back. It was taking like 4 or 5 days for the test results to come back. But then you're like, oh, this person has symptoms now.
Right.
And then the test would start coming back. And then it was like one room after another. It was unbelievable how it went, just wiped out the entire unit, the entire one. And at that point, I was working with a lot of the patients down there because they were having the trouble swallowing.
Right.
And it was extremely sad to sit with like a 90-year-old woman and say, the person next door has it, I'm next.
Right.
And they would look at you scared,
Yeah.
It's very emotional to sit with someone who has had such a long life, and they talk about their family, they have the pictures all over the wall, and they just look at you and they're like, I haven't seen them, and I'm gonna get this virus.
I'm next.
And yeah, I'm next.
Did you hear that a lot?
Yeah. And the first woman that I worked with, that I'll probably never forget her face, because she just looked at me and she said, I feel like I have pneumonia and I feel like this is going to kill me.
Right.
And then 2 days later, she was positive and she got sent out and she did die.
Right.
So that'll probably sit with me, because there's nothing you can do.
Right.
It's...
Yeah. Yeah. That's got to be really hard to sit with that.
To not see your family is just...
Yeah. Just to know that it's coming and also not have that support. Yeah. Terribly sad.
Yeah, it is.
Yeah. I imagine you saw that quite a lot too. It wasn't just the one instance.
Yeah. Fortunately, this first wave, it only went through one of our units and the others were fine.
Right.
Now this second wave, we have people positive on every single unit.
Really?
So there's no telling if it's going to go through the entire building or if we've caught it, because now this time around we're able to test people every day if we need to, so there isn't that 4-day lag anymore. Right. So the week before Thanksgiving, we had maybe 3 or 4 employees come back positive, and then it stopped. And then a week ago we had 3 more employees, and then 3 residents, and now 4 more residents. So just in the last week and a half, it went from nothing to maybe like 11 people or so. Wow. So I can go back to work on Monday. It could be a very big change. So we had to transition to a COVID unit on Wednesday. So Wednesday we had to empty out, and our rehab floor, we had to call the families up and say, we now have COVID in the building. We have to send your person home. Are you ready to do that and set up home therapy?
Really? Send this person who's in long-term care, we have to send them?
No, the rehab patients. Yep. So if they were there for rehab and they were potentially going to go home eventually, they tried to have our social worker set up them to go home early instead of staying for another week or 2.
Right.
And they shut down our 3rd floor rehab for now COVID patients. So now our long-term care patients, as they turn up positive, are going to get sent to our 3rd floor.
Wow. Man. So, and today's Christmas Day, so we're a long way away from March and April, but would you say that this is worse now or better, or how would you gauge it compared?
I think it's too early to tell right now.
Okay.
The first time around, it went very quickly. It was like within 3 weeks, the whole unit was just positive. Now it's like we have 3 or 4 patients in a couple days span, and you don't know if it caught on to like really keep going or if we've caught it soon, because we were able to test everyone, rapid tests, where we weren't able to do that in March.
Right.
And April.
Right.
So now the rapid testing, everyone pretty much every other day, all the workers and all the patients. So they're trying to stop it.
Right. Have you had coworkers who've been infected or passed away or just very sick?
No one passed away, or coworkers in my building. There have in other buildings.
Wow.
Yeah.
Wow.
So
yeah,
I know our facility in Wall, they had a coworker who passed away
from COVID. Wow.
Yep. Yeah.
She got it at the facility.
Yes.
Wow. Wow.
Yeah.
Yeah. So I'm curious, because you have kids, you have a husband, how do you draw that line and come home and be with your kids when you're experiencing so much illness during the day? I imagine that's a really hard thing to do. Is it possible to do, or is it just when you're on the front lines like this, it just inevitably sort of comes home with you?
It comes home.
Right.
It does. I would say that your line of work always comes home with you.
Sure.
A little bit, Right. I'm managing with it better now than we were back in March or April. I was very nervous to have brought it home to my kids or my husband,
Because you have, how old are your kids? I mean, I know.
2 and 3.
2 and 3, yeah. Yeah. Were you concerned that they might catch something from you, or your husband might catch something from you?
I was, and our kids go to the daycare that's for our employee staff, and so they could not close like the rest of the daycares because it's for medical essential personnel. But I did take them out because I was nervous. I don't work in the ER, but there are kids that have parents that work in the ER, and I was afraid that they would get it there or they would get it from me, and I wanted to limit the exposure as much as possible. They did eventually end up closing most of the daycare. They asked for people that had a family member that was at home, if there was someone home, to take your kids out. So they were out of daycare from March until July, I think, at that point. So by July, we were okay. There weren't any patients that were positive, or we went months and months without any issues. And then it's just the week before Thanksgiving that things started to pick up again. So the
infection rates have been going up.
Yep.
The infection rates within Monmouth County and within the country have been going up quite a bit. You mentioned to me earlier that there was one facility that had like 80 people get. Can you talk about that?
We have, the way that it originally was working was that they wanted to limit the long-term care residents as much as possible. So the facility, our most northern facility, was the one that got hit first. So they weren't able to really control it. When it started to come down to, we have 5 long-term care facilities. When it started to come down a little bit more south, then when we would have residents that tested positive, we were trying to send them out of the facility. So we would send them to the northern facility. So we were trying to take the long-term care residents out of our facility to stop the exposure and stop the spread. So some facilities that were northern, more Homedale, they ended up having a ton of residents that were COVID. And then they were accepting residents from other facilities until it got to a point where they could no longer accept. And then that's where we ended up being, where, once we couldn't send them anywhere else, then we just had to keep them for ourselves. And that's when it spread like crazy. But our most northern facility did end up having about 80 people pass away in that first couple of weeks.
Wow.
So
shocking.
Yeah.
Yeah.
Yeah. So it's been, we don't know what the future is for like long-term care, because a lot of our residents have died. So all of our censuses are very low. Like my building is normally 144 beds, and we're running at like maybe 70 people right now.
And for 144 beds.
So we're at 50%.
And because so many people have died. Wow.
Yeah.
Wow.
And we're not taking in admissions anymore because we don't want to. Now that we have to be a COVID unit, we can't take people from the hospital because we're going to need those beds that normally would be for our hospital patients to be for long-term care patients that have come up positive.
Wow. So what was the ratio, say, pre-COVID? Was it full? Was it 144?
So 144 beds, it would be about 25 to 30 would be subacute rehab patients coming from the hospital with like strokes or, COPD, things like that. Like if they were in the hospital for a couple of weeks, they'd come over for rehab. That would be like 25 to 30 people. And then the rest, like 115 long-term care residents.
But it was full.
Oh yeah, all the time. Like we would never have a really low census since I've been there for maybe 8 years or something.
Wow.
So normally like the lowest we would get is like 130.
So having a 50% is that's very low.
It's very low. And it's like that in all of our buildings.
Wow. Because there's just no more, I'm going to close the door, but there's just no more, people are dying from, and so they can't really fill the spots.
There's people that are passing away and those beds are empty, and then on top of it, the beds that would be filled from people going to the hospital. Now the hospital, people are afraid to go to the hospital. They're not going in for things, or they're requesting to go home instead of going to rehab when they might actually need rehab. People are scared to go into a rehab facility. So the censuses have been low.
Right.
Very low.
Right. Wow.
So you don't know what the future will be. It's the same thing. You see it everywhere on the news that people are avoiding like their routine checkups and their cancer screenings and everything because they're afraid to go where they need to go.
Yeah.
So
more well aware of that too. So you were scheduled to get the vaccine, but then it didn't happen. So there's now a vaccine that's out in limited supply. Obviously, it's going out mostly to first-line workers like yourself. And you were scheduled to have it before Christmas. Can you talk about what happened?
So the state is in charge of vaccinating the long-term care facilities and their workers. They had planned to vaccinate December 21st, and then they kind of pushed it back to the 28th, and now they partnered with a pharmacy to have the pharmacies go out and vaccinate the long-term care facilities, and now it's kind of they're
CVS
telling us,
or Rite Aid?
Yep, CVS.
Okay.
So it's being pushed back to, I want to say, the second week of January.
So the hospitals partnered with CVS or the state partnered?
Hackensack Meridian got their own vaccinations for the employees of the hospital. So they've started vaccinating their employees in the hospital. The state is doing the long-term care facilities. So even though like I work for the same corporation, the state's doing ours.
Okay. And you haven't received yours yet?
No.
Okay. But because you're part of the long-term care facility, you're sort of separated from the rest of the employees, and so they're like, the state will take care of you. And then Hackensack Meridian, which sounds like already has the vaccine.
They do have it for their hospital staff.
So they're starting to get vaccinated.
Yeah.
But you have to wait because the state doesn't.
Yes. So the state's doing us.
Right.
It's just a matter of when they're going to schedule and come out and do it.
Right. So that's got to be a little frustrating.
It's a little frustrating because we were told we were going to be the priority, and they knew that long-term care facilities were a target and that it's the most vulnerable population. So we had thought we were going to get done as quickly as possible. It is a little frustrating now because it's like the past week now we're having an outbreak. It's like we should have got vaccinated.
Now is the time.
Right.
Yeah.
Because now we don't know how bad it's going to be or whatever. I don't think vaccinating last week would have changed the outcomes that we have right now because, we're in an active infection rate. But it's still, some of the other long-term care facilities aren't really having an active infection right now. So they should be getting vaccinations,
Yeah. Right. Yeah, that's amazing. So you mentioned a really bad day, when you had to say goodbye to people. Is there what would sort of quote unquote a good day look like, or is there a good day? Is that not really a thing?
There are good days, you know,
Okay.
like your coworkers, everyone's trying to keep everyone's spirits up, and you know,
is there a lot of like
we're all
morbid
in
humor?
this.
You hear a lot of
Yes.
Yeah.
There is a lot of morbid humor.
Right. Any
You know,
examples of that? Yeah.
I don't know.
Yeah, go to it.
You know, we just trying to get by.
Right, of course.
I don't know. It's there are good days, and you know, we had a resident who was COVID recovery, and he was actually going to stay with us long-term care, and he ended up going home like maybe 3 weeks ago. So that was a big accomplishment. Like, that was a good day because he was young. He was only 50 years old. He had a 5-year-old son at home, you know.
And he had COVID.
He had COVID, which resulted in a stroke, and he had a lot of residual deficits, and he was bedbound, and he was contracted, and we thought he was never going to move, and he ended up walking out the door. So like, those are the types of patients that you're like, this is why we do this.
Do you see COVID acting in really mysterious ways? Because you hear about that it just is a very mysterious disease. Like,
we have patients that are positive that you'd never suspect. You know, they're routine.
What's the youngest patient you've seen?
Youngest in our facilities?
Yeah. You said 50.
Yeah, 50 is usually about our youngest that we would go because we are long-term care. Right. So our population's like 50 to like 105, you know? Right. But some people, routine swabs come back positive, and you're like, no way, like there's no fever, there's no symptoms, there's nothing. And then other patients are like, they got to go to the hospital, they're on a vent, and you know, they're doing terrible. Right. You know, like the week before Thanksgiving, we had maybe 3 or 4 patients come up, and, you know, 3 of them are asymptomatic with nothing. And then one of them's coughing up blood, you know. It varies. It's really weird how it affects different people.
You mentioned somebody had it and then they had a stroke. So it seems to be that you're hearing a lot that it affects a lot of different systems of the body, COVID, like neurological system, even, you know, like there's this whole long hauler thing.
So it does, I don't know if you heard a lot about like how it affects like the blood. So I mean, it can thicken the blood, and that like it can cause blood clots. Okay. So some people are getting blood clots, and they throw a blood clot, and it results in a stroke. Right. So that's one of the ways that it can affect someone. Right. The neurological things, you know, the loss of smell, the loss of taste, that's neurological. But and then there's a lot of respiratory. You know, some people just get the respiratory aspect, and then some are getting no symptoms, or you know, there's a lot of strokes. African American population, they're usually having some strokes. Younger, 30s to 40s, they're seeing like mild strokes.
30s, people's in their 30s and 40s. Wow.
Yeah. Oh. It's a weird virus. Yeah. It's a really weird virus.
Yeah. You mentioned the African American population. Do you see kind of an unequal racial distribution or socioeconomic distribution among your patients, like in terms of who gets COVID and who doesn't?
No.
Okay.
I mean, again, we have a diverse population, but I think everyone can get it differently. It affects them differently. I don't think that it matters who gets it, but the results of it are different for everyone. So, you know, African Americans are more likely to have strokes to begin with. They have higher risk. So I don't know if that's why it may affect them more with COVID for a stroke resulting, but I don't know. The younger, they were saying that there was a lot of people in their 30s and 40s as well that were ending up we don't have 30 and 40-year-olds with strokes in our facility, but some are resulting in strokes. Wow. So.
Wow. Yeah, I mean, 'cause I just read this New York Times article that said that the mortality rate year to date for 20 to 30-year-olds is much, much higher than it was. So there's this misnomer that it doesn't affect young people, but it does. So a few more questions. When you see someone and you suspect COVID, how does it start to progress? How do you notice them change? I mean, I know there's no one way, but in general.
It's weird.
Okay.
It's almost like a knowing, like you can, I don't know. It's just like a gut feeling when you go in to see someone and they just start talking to you. And, normally, you work with sick people all the time, but there's just something that makes you go, this just doesn't seem right. And usually your gut instinct is correct. Some people aren't symptomatic at all. So there's really no knowing.
Right.
It's different.
Yeah. So a lot of what people have been saying, has been helping is rotating people and to help the congestion in the lungs. But I imagine with an older population, you may not be able to do those types of interventions.
And that's more like what they're doing in the hospital. The
Okay.
people that need to be ventilated, they need to change their positions frequently and whatnot. Are people that aren't hospitalized, they might have a cold or a cough, but it's not to the point that some of them may get like mucus plugs and whatnot, but it's manageable.
Okay.
If it wasn't manageable, then we'd be sending them to the ER.
Right.
I don't know. It's challenging.
Right. Sure.
It's the aftermath for my population. A lot of people that we had sent out to other facilities or to the hospital when they were positive the first time around, we had about maybe 45, 50 people positive the first round. And when they would return to our facility.
When you say first round, like in March or April?
Yeah, in April. So they would be out for a couple weeks, and then when they would test negative, then they would come back to our facility and go back to their long-term care floor. It was the aftermath that really, we had a lot of people not die during the active infection. They would already be testing negative, and then they would pass away. So
after they tested negative? Well, why do you think that was? Because
they had loss of appetite. They lost weight. They just lost desire to live.
Oh, wow. So just the experience of going through it?
Yep.
Whoa.
I would get phone calls from the speech therapists in the other buildings, and they would ask me what their prior level was and how they're doing. And they would say, all they say is they want to go home. And you wouldn't think, like, being in a long-term care facility that they'd want to be there. But, you're going from a facility that you've lived in with your pictures on the wall and, your stuffed animals or whatever that they have. Yeah. And now they're in another building with nurses that they don't know. So, in a way, the staff is their family, and then you're taking them out of their comfort zone, out of their home, and away from people that they consider like their family. And then they were in facilities with people with the full gear on that they don't know or recognize. And they would lose a lot of weight because they wouldn't be eating. And they'd come back and they would just be very deconditioned, weak. And the appetite just wouldn't come back. And a lot of the patients, we would have a good amount that would transition to hospice and then pass away like a couple months after having recovered from COVID.
Wow.
So.
Or testing negative entirely. So it's almost, it seems like the through line or the theme of a lot of what you're saying is that the emotional aspect of just trying to survive the isolation of this event was as traumatic, if not more so, than the actual illness in some instances.
Yeah.
And as lethal.
Yeah. You hear, mental health being an issue with, younger individuals that are you're still able to go to the store or, see people in small amounts. These people in the long-term care facilities are isolated.
Right.
They're isolated.
Right.
There was a period of time where they were allowed to go outside for 20 minutes or sit 10 feet away from one, at most 2 visitors at a time. They were never allowed more than 2 visitors at one sitting.
Right.
And they were only allowed to schedule 1 visit per week.
Wow. One visit per week?
Yeah.
Wow. For like an 80 or 90-year-old.
Yeah.
Yeah.
So.
Man. Yeah. Wow.
You know, so you think about it like they were born, raised, went through the depression, everything else, and then they get to be like in their 90s and they're in a nursing home, and it's like, this is how you spend the last of your days. It's like, oh, haven't you been through enough? No.
Right, yeah. The last moment of your life has to be isolated, trying to survive a pandemic.
Yeah.
Mm. That's terribly sad.
Yeah. Yeah. I mean, we think about how sad our lives are, and it's like, oh man, we can't do these normal things, and then you don't, you know, a lot of people don't think about those individuals that are in long-term care. That's isolating. Right,
yeah. Well, you seem like a great advocate for them, and you speak really eloquently about them. And I haven't seen, you know, you at home, but you seem to have managed to keep yourself, sort of your energy going and your positivity going and that type of thing. Which is remarkable in a way, because it's got to be tremendous work. Mm-hmm. Yeah. Well, thanks so much. I mean, this has been really enlightening. Really enlightening. And I usually ask everybody, is there anything else you'd like to say or record for posterity?
Oh, I think I said a lot.
You did. You did.